All right, so the number of infected people in South Africa has risen in the last few days, as we've been reporting, and the WHO has now declared it a pandemic. To talk to us a little bit more about that, we're now joined from our studios in Pretoria by the UN's World Health Organization resident representative, Dr. Owen Kaluwa. Thanks so much indeed for joining us, Dr. Kaluwa. All right, let's talk a little bit about this status. It's been now given to pandemic levels. Explain the difference to us in terms of the previous announcement and this one. What does it mean to get to a pandemic stage?
Since the outbreak of coronavirus in China, when we were notified on the 31st of December, WHO has been closely following up the evolution of this outbreak globally. And by the 30th of January, the Director General, on advice of the International Health Regulations Committee, declared it a public health emergency of international concern, with very high risk of transmission within China and high risk globally. And at that point, really, the call was for member states to work together in order to stop the spread of the virus. And that was one of the highest risk levels that WHO has in terms of alert. But after that, we'll continue to follow the evolution of the epidemic or the outbreak. And what happened then was that over the past few weeks, there was a large increase of the number of cases outside China, about a 13-fold increase and a 4-fold increase in the number of countries that are reporting cases outside China. And these developments led the World Health Organization and the risk assessment in the situation to declare it a pandemic. But in declaring the pandemic, as it was clearly said by the WHO Director General, they declared a pandemic that is controllable and emphasize that countries should continue to strengthen their capacity for containment, which should be the center pillar for continued response to this pandemic.
All right, so what protocols must kick in now that we've ratcheted up to pandemic level?
Basically, the core is that there should not necessarily be a change on the strategy. What it calls for is more agency in dealing with the problem. So we should continue to focus on containment in a number of countries, which is about detecting the cases, treating those affected, and ensuring that there is contact tracing for all cases and follow-up. And in addition to that, to look at what other measures in terms of mitigation should be put in place, so that there should be a mix of measures. But the most important thing is the agency through which this should be done, and calling about a whole government or whole society approach in dealing with it. So in other words, this is a call to action, not a call for people to be scared or a call into inactivity, but in other words, to spare us more into much more action, much more concerted action in countries and globally.
All right, so in Africa, it looks as if perhaps we're still in the containment stage. We've seen the United Kingdom move into what they call delay, and we've even seen Italy almost shut down the country completely. What needs to happen for Africa to move into the delay stage, and what does that describe?
Well, I think for Africa, the recommendation basically is for most countries, near all countries in Africa, to focus much more on the containment so that we can interrupt transmission. And once we do that, we will be going a long way to addressing the problem of the COVID-19. And indeed, that's where we should put our efforts, identifying the cases, treating those who are affected, following up all contacts, educating the public so that they can implement the various measures that will protect them from contracting the virus.
When should South Africa become concerned? We're at 17 now. What number, is there a number that sort of triggers the next stage of action?
I think once the outbreak was declared a public health emergency of international concern, at that point, all countries should have been concerned about this outbreak and continue to respond to it in a manner of ensuring that they prevent importation, and if that happens, they make sure that they contain the spread. So at the moment, really, the effort should continue to be the acceleration of the work that is already happening towards containment.
We have in South Africa a good number of people that are living with HIV and TB. Are these people vulnerable in any way to a virus such as this one?
Well, what is known so far is that those people who are in any way immune compromised, or those people who have underlying conditions are at a heightened risk, or those who are older are at a higher risk of developing a serious disease. So one would say, therefore, that maybe those affected with HIV, particularly those who are not on treatment, or those affected with the TB, might have much more impact or effect of this particular coronavirus or COVID-19. But I think what one needs also to say is that this is a new virus, and a lot of things we are learning as it evolves. So we are yet to understand more about exactly what will be the impact of this virus in these populations.
We're about to go into the winter cycle, and with that comes the flu. Will we be able to tell the difference between flu symptoms and COVID-19 symptoms? Otherwise, my fear is that every second person is going to end up going to the hospital.
Well, the symptoms are fairly similar, but there are, in fact, some of differences which can be picked up by the clinicians. But I think what's important here is that as the flu comes on, the season comes on, we should do all we can do to try to minimize the flu itself, in terms of recommending the normal flu shots for seasonal influenza, and also, luckily enough, the measures that we are promoting in terms of control of COVID-19, in terms of hand hygiene, in terms of coughing into the tissues, throwing them away, and in terms of also coughing into flex hand, etc. All these measures also minimize the acquisition of flu.
All right, and perhaps finally, now that we've reached pandemic status, is there more work that the WHO will be doing across the continent with this new status?
Yeah, the WHO will continue and intensify its support to member states. As I said, in ensuring that we focus on containment, or we implement a mix of measures, containment and mitigation, as the situation is on the ground, and provide the necessary guidance to member states to really scale up the interventions in regard to addressing COVID-19. The issue here is we have to focus on what we need to do. Yes, the problem is a big problem, and yes, there's a lot of anxiety in people, which is correctly so, but to avoid panic, so that we can systematically deal with this problem, focusing on interrupting transmission, and where necessary, looking at what are some of the mitigation measures we can put in place. At the same time, it allows us some time to try to innovate and try to learn from each other in terms of what interventions would work under certain circumstances. We need to look at also focusing on research and development, particularly also on issues around the development of vaccines and other tools that we need to deal with COVID-19.
All right, so Dr. Kaluwa, that's where we'll leave it. Thanks very much indeed for joining us on the program and sharing your thoughts and insights with us.